Hello, my name's Dr. Catherine Atkinson and I'm one of a group of anaesthetic consultants who are involved with the preoperative assessment clinics at the Oxford University hospitals. Part of our role is to help ensure that patients are as well as they can be and ready for their surgery. Sometimes, as part of this pre-assessment process, we ask patients to undertake a cardiopulmonary exercise test, or CPET, to assess their overall fitness. We have produced this short film about CPET so that when you come for your test, you know what to expect and it all feels quite familiar. The cardiopulmonary exercise test, or CPET, can provide us with very important information about how your heart and lungs work to ensure enough oxygen gets around your body. This is important both during major surgery and afterwards in helping you recover. The CPET is not a test that you pass or fail. It is intended to provide the anaesthetist and the surgeon with important information to help plan your anaesthetic, your surgery and the care after your operation. It also helps provide more accurate information about the potential personal risks of the intended operation so that you can be more fully informed about the risks and benefits of surgery for you personally. It is important on the day of the test that you do not have any drinks with caffeine in, such as coffee, tea or Coca-Cola, as this may affect the results, but other fluids can be continued up until the test. Please don't have a heavy meal in the 2 to 3 hours before your test, and if you are currently smoking, please don't smoke before the test, as this can also interfere with the results. As the test involves you pedalling a stationary bicycle, we advise that you wear clothes and shoes that you would feel comfortable cycling in. You will receive an appointment either through the post or over the phone. It will be made clear to you at the time whether this appointment is at the John Radcliffe Hospital or the Churchill Hospital and where you should go when you arrive. If you also require an appointment with one of the preoperative assessment nurses, we will try and make this appointment on the same day as your CPET. Before the CPET, a nurse will check your height and weight. She will then escort you to the CPET room, where the anaesthetist will go through a series of questions about your overall health and any significant medical problems that you might have, and explain the test to you. As the anaesthetist will need to know about any medications that you are currently taking, it will be helpful if you could bring a list of these with you on the day. The first part of the test is a measure of your lung function and will take approximately 3 to 4 minutes to complete. A soft plastic nose clip is used to ensure that you breathe in and out of your mouth. You will then be asked to breathe normally through a mouthpiece for a few seconds before being encouraged to take a really big breath in and fill your lungs up to capacity. As soon as you feel that your lungs are full, you are told to breathe out as hard and fast as you can and continue breathing out with the same breath for about 5 seconds. This lung function test is often repeated 2 or 3 times to ensure that accurate values are obtained. We will also be monitoring your heart rate through some sticky dots called electrodes that have been placed on your chest. To put on these electrodes, we will need to ask you to take off your top. But you can put it back on once they are all attached, or we can give you a hospital gown to wear for the duration of the test. The second part of the test involves you cycling either on an upright stationary bicycle, identical to those that are used in leisure centres or gyms, or on our recumbent sitting bike. Both bikes will be adjusted so that you are comfortable as possible and can pedal easily. Our experience is that even patients that haven't ridden a bike or done much exercise for some time manage to complete the test without too much difficulty. We also monitor the oxygen levels in your blood through a small peg on your finger and your blood pressure with a cuff on your arm. During the test, you will wear a soft mask that allows the collection of the gases that you breathe in and out during exercise. It is a soft, stretchy mask that goes over your mouth and nose and fastens behind your head. It's not as bad as it looks and doesn't restrict your breathing at all. During the test, we ask you not to talk because it affects the results, so if you have any questions, please ask them before the test or after the test is finished. At first, you will just sit on the bike for a couple of minutes while all the baseline measurements are made. Then you'll be asked to start pedalling. For the first 3 minutes, this will be quite easy. An ideal rate to turn the pedals is 60 times a minute. There is a screen on the bike which will tell you what rate you are going, so you can adjust your speed accordingly. After the first 3 minutes, it will gradually begin to get a bit harder, as if you were trying to pedal up a hill. The important thing is to try and keep going for as long as you possibly can to see how far you can get up the hill. For most patients, the test lasts about 8 to 10 minutes. However, if at any point you feel unwell, very breathless, tired or get chest pain, then do stop. Otherwise, the longer you can continue, the more information we will get from your test. The doctor supervising the test will stand with you the whole time. Once you've indicated that you would like to stop, we will remove the mask and the bicycle will become very easy to cycle again. Please keep cycling slowly for the next few minutes until you are asked to stop. After the test is finished, you will be detached from all the monitors and can sit and rest and have a drink of water whilst we look at the results. We will often be able to discuss the main results of the cardiopulmonary exercise test with you and answer any questions that you may have. We will look at the test in more detail and write a formal report which will be filed in your notes and sent directly to the surgeon responsible for your care. We will also write a letter, and you and your GP should receive a copy of this in the post within 10 to 14 days. We hope you found this short film useful. If you have any other queries or questions about your test or your appointment, then please do ring the preoperative assessment clinic.